from all of us at Apollo Hospitals and welcome to our Corporate Health Series. This is Dr. Srinidhi Chidambaram here. In your hectic lives, I'm very sure that you really do not have much time to develop awareness on all aspects of health and disease. It's probably the last thing on your mind. So here we are from Apollo, constantly and consistently providing information, the right health information, giving you the opportunity to take accountability for not just your designated role at work, but also for your health and for the health of your loved ones. Today, we take up a session that will explain how you need to take care of your windows to the world, your eyes, the sensory organs that allow you to see. And these are very complex organs. They capture visible light from the world around you and turn it into a form that your brain can use to create your sense of vision. They're complex organs with many parts as well. So they all must work together to produce clear vision. So while maintaining overall eye health through a healthy lifestyle, the right kind of diet, avoidance of sun exposure, wearing protection, minimizing screen time, these are, of course, very important. But we are today going to also discuss two conditions of the eye that are very prevalent, which you already must have heard about. And these two conditions require some awareness for early detection and treatment. So we're going to discuss the two conditions of glaucoma and cataract. Cataract, as you know, is a clouding of the lens, which can cause blurry and reduced vision. And glaucoma is something which causes increased pressure of the fluid inside your eye. Both are extremely important and things that you must know about. So to discuss these two eye conditions in detail, I am delighted and honored to welcome Dr. Abhishek Hoshing. Dr. Abhishek Hoshing is a highly skilled ophthalmologist with 8 years of experience in the field. He holds an MBBS degree DNB along with the fellowship in corneal transplant surgeries, refractive surgery, and ocular surface diseases. His areas of expertise are many, some of which include cataract surgery, corneal transplants, limbal stem cell transplants, amniotic membrane transplants, pterygium surgery, anterior uveitis, and refractive surgery. He currently serves as a consultant ophthalmologist at Apollo Hospitals in Navi Mumbai, has previously held very senior positions at the Lakshmi Eye Institute and the LV Prasad Eye Institute. Dr. Hoshing is also an active member of several professional organizations, including the All India Ophthalmological Association and the Cornea Society of India. And in fact, his multilingual proficiency in many Indian languages and English allow them to effectively communicate with a diverse patient base, enhancing his ability immensely to provide comprehensive eye care services. Welcome, Doctor, to this session. Thank you so much.
Yeah, namaste to everybody, and thank you for that kind and warm welcome and warm introduction.
So let's begin by discussing the first of these conditions that I was talking about, which I think everybody must be quite aware of, but may not know exactly what it is: cataracts. So what are cataracts and how do they really develop?
So, like you rightly said, cataract is the clouding of the lens. So, simply put, all of us have a lens inside our eye, and that lens, like all the other structures in our body, is made up of a specific protein, and there are different proteins in the lens. But the unique property of these proteins is that they are transparent because they have to allow light to pass inside the eye so that the eye can capture it. Now, with time or due to some disease conditions, the transparency of this lens protein is lost and it starts becoming more opaque. And thus, it does not allow adequate light to form, and it sort of creates a barrier in the path of the light. and which is essentially what cataract is. So this protein is also encapsulated, or it is contained within a pouch, which is called a capsule. And so any opacification of these lens proteins, or the capsule within which it is contained, or the bag within which it is contained, is called a cataract in the simplest.
So, at what age do people develop cataracts? Is it really something that only very old people get, or is it even in younger populations?
So there is no age where a person can develop cataract. In fact, due to some conditions, even newborn children are born with cataracts in their eye because of some maternal infections during the pregnancy, etc. So, right from the very birth to the old age, people can get cataract due to various reasons. So, most of the times for people who are at a younger age group, if they develop a cataract, that is usually secondary to some sort of a injury or medication or some sort of an insult to the iron in the form of an infection. But in the older ages, it is just a normal aging process in which the transparency of the proteins inside the eye has gradually reduced to become more and more.
Are there any preventable factors that lead to the development of cataracts?
So, if there is if there is a systemic illness like a diabetes or a high blood pressure, or any illness which requires prolonged use of medication like steroid, then keeping these illnesses in control will definitely prevent the development of cataract. Also, in during pregnancy, there is a whole panel of tests which the obstetricians advise to check whether there's any maternal infection inside the uterus. So, if those infections are uh, identified and cured adequately, then there is a possibility to prevent cataract in newborns, but that is not a sure shot guarantee. But just to keep your illness in check, just to keep your diabetes in check, in high blood pressure in check, this can prevent cataract. This can delay the formation of cataract, but eventually, even these people will get cataract. So there is no 100% preventive measures.
So, are there any stages for the development of a cataract?
Yes, there are stages for development of that, and but those are very technical classifications. And to explain it to in a very common term would be very difficult, because the classification and the stage classification is based on what we observe during our examination in the OPD. But broadly speaking, there are two types of cataract. One is called an immature cataract, where there is cataract, but the patient vision is slightly blurred, or it might be just mildly affected, but the patient might still be able to see something of their surroundings. So that is an immature cataract. And then there is a mature cataract, in which the lens is so opacified that there is no good eyesight in that eye at all. And if you cover the other eye, that person is like potentially blind. So that is the mature. So in both the scenarios, uh, treatment is possible.
And what would be the earliest symptoms of a cataract that one should kind of keep a lookout for?
Earliest symptom of cataract will definitely depend upon what type of cataract it is. There are different types of cataract depending upon what area of the lens or what depth of the lens is getting affected. But the most common early symptoms of cataract is one, obviously blurring of vision. There is gradual, progressive, painless loss of vision. The patient does not have any pain, any redness, any discomfort in the eye, but there is a gradual, progressive loss of vision. That is the most common one. Apart from this, there might be conditions where the patient might be seeing uh, the rainbow-like circles or halos around light bulbs. Sometimes things appear double or multiple in nature. So people do complain that I can see three moons or four moons. Now this happens because different areas of the lens are behaving as different lenses because it is undergoing certain change. And sometimes patients may also complain of seeing a black spot right in the center of their eyesight, where they are not able to see what they want to see, but they can see the things around it much more clearly. So the thick areas around those area of interest or object of regard, what we say, are more clearer than the right in the center. There is a black spotlight. So these are various early symptoms of cataract in which it is essential to get an eye checkup.
And what would be the ways? I mean, cataract surgery is something that is, I'm sure everybody in anybody's family, there'll be somebody who has undergone a cataract surgery, and it doesn't seem to be something that's very complicated. And but then, what exactly happens in a cataract surgery?
So, like I told you that there is a bag-like structure which is called a capsule, which sort of holds or contains all the protein matter which has undergone opacification or it has lost its transparency. So, during a cataract surgery, what we do is we enter the eye and then we make a small opening in this. And what we do is we liquefy all this abnormal protein within the eye and then suck it out of the eye through a very small opening. So basically, what we are left with is a clear bag which is devoid of any opaque protein. Now, because this protein was what was actually the forming the crystalline lens, but we have now removed the lens out of the eye because we have removed all the unhealthy proteins. We need to replace it with a artificial lens. So what we do is we have this bag which is empty now. So we just put a artificial lens inside the bag. So we essentially open the bag, remove all the unhealthy protein, and put a lens, new artificial lens inside the bag. And that is essentially, in broad terms, what cataract surgery is all about.
And what would happen if a cataract is just left untreated?
So, if a cataract is left untreated, like I said, eventually it will progress to such a high level or it will mature to such a high level that there will be no light passing inside the eye. So, the patient is blind in that eye. So, the patient can only maybe just appreciate that there is some light present, but there will be no useful vision in that eye. So, that person cannot see anything from that eye, which is will be of any use. That is one. Secondly, sometimes these mature cataracts can develop into another stage which is known as hypermature cataract. And then what happens is the protein it liquefies and it punctures through these capsules or the bag-like structure inside and starts leaking into the other structures of the eyeball. And then this leads to a sudden rise in the pressure of the eye because it blocks the all the escape channels, and then the eye becomes painful, red. There can be a lot of vomiting, a lot of discomfort, swelling up of the eye. So this is what happens if you just leave the.
And is there a situation where, after a point it is not treatable, or is it treatable at any stage?
No, cataract is treatable at all stages. So whether it is an immature stage, but it is causing significant vision loss, or the person is not able to perform daily activity, day-to-day activity, that is at that stage also we can do. And also at a mature or hyper mature stage, also the cataract surgery can be done with equally good results, and the patient can recover all the vision that he or she had lost, provided every other structure in the eye is also absolutely fine and functioning properly up to the mark.
I think now we can move on to the next eye condition, which is, I think, commonly even known as the silent thief of sight, which is glaucoma, which is something which people I feel are not as aware as they are of cataracts and refractive errors. So, what is glaucoma?
So glaucoma essentially it's a basket term. There are many conditions which basically come under the purview of the term glaucoma. So glaucoma happens because of certain damage to the optic nerve. The optic nerve is basically it's like a cable which carries the signal from your eye to the brain. So there are certain characteristics
as aware as they are of cataracts and refractive errors. So, what is glaucoma?
So glaucoma, essentially, it's a basket term. There are many conditions which basically come under the purview of the term. So glaucoma happens because of certain damage to the optic nerve. The optic nerve is basically, it's like a cable which carries the signal from the eye to the brain. So there are certain characteristic damages which happens to the optic nerve, which creates characteristic patterns of vision loss. And essentially, in the early stages, it is more in the periphery. That is, the sides of the vision are affected more and not the center. That is why the patient is not aware of the vision loss immediately. But and usually this is caused by a rise in the pressure inside the eye, which is the fluid pressure inside the eye, which keeps building up. So it's a triad of three things. One is uh, fluctuation in the pressure or the rise in the pressure. Secondly, characteristic damage to the optic nerve, and third is characteristic patterns of vision loss or with what we call as field loss, because it's an extent of vision or the field of vision which is losing in the initial stage. Later on, the central eyesight is also.
So, what would be the early warning signs that people should be aware of that they might be having?
So I think this my answer will also cover another part of your another part, which is what are the types of glaucoma. Basically, there are two types. One is called a angle closure glaucoma, in which there is a distinct narrowing of the drainage channels through which the water inside the eye or the fluid inside the eye gradually drains out. So in these scenarios, this is called an angle closure glaucoma because that area is. So in these patients, there can be a sudden closure of all the channels, which is called an angle closure, and this can lead to sudden rise in pressure. And this sudden rise in pressure can lead to frequent redness, one-sided eye pain, headache on one side, episodes of vomiting, and after a certain point of time, this resolves back and goes back to normal. So if anybody has a similar history where there is an eye pain, repeated eye pain, repeated headache on one side, redness of eyes, then it could be a angle closing glaucoma. So that is one of the early warning signs of angle closure glaucoma. There is another variety of glaucoma which is known as an open angle glaucoma, in which there is no such sudden closure and no such sudden rise in pressure, but the pressure sort of keeps on building gradually, and after an extended period of time, the pressure builds up so much that it has already caused a lot of damage. Now, this is the more dangerous variant because it is a very, like you said, it's a very silent thief of sight because the person may not have any sudden pain, no sudden redness. Okay, most of the times, open angle glaucoma diagnosis is an incidental finding where we find that the person has glaucoma just during some other routine eye checkup for a glass power or some cataract evaluation. So it is essential that we need to have at least an eye checkup once every year to see whether there is a propensity to have a glaucoma or whether you have already developed glaucoma, or if you have a family history of glaucoma, then it becomes all the more important to get an especially for these sort of conditions.
And what would happen if the glaucoma is ignored?
Okay, if the glaucoma is ignored, then the pressure of the eye is constantly high. Now, this constant high pressure causes lot of optic nerve damage, which is what I said in the earlier part of the talk. And this optic nerve damage, the problem with glaucoma is unlike cataract, whatever is the vision loss due to glaucoma is not recoverable. So cataract, even if you operate it in the hypermature stage, you can potentially get back the complete vision. But glaucoma, if we just allow it to fester and progress to a higher level, then whatever vision is lost permanently. It's a permanent damage. So that is why it is essential to identify and diagnose glaucoma early and to treat it. Now here the treatment is aimed at controlling and preventing further progression. If we detect glaucoma at 50% damage stage, then we can prevent the rest of the 50% from getting damaged. We cannot recover the 50% which is already lost. So it is essential to maybe diagnose and identify glaucoma where the damage is at a much lesser percent, where it is at let's say 10, 15, or 20%, so that we are still able to preserve almost 75 to 80 or even higher percent of vision for the patient.
And what are the ways in which it is treated?
So the initial treatment of glaucoma almost always begins with eye drops. So we have pressure reducing drops. These drops are prescribed usually at 2 to 3 times in a day, sometimes even once a day, depending upon the how severity of glaucoma. And these eye drops, they reduce the pressure and reduce the pressure induced damage to the optic. So that is the initial treatment of glaucoma. If the uh, pressure is not getting adequately controlled by the drops alone, then there are surgical procedures which create alternate channels for the egress of the fluid inside the eye, and this fluid sort of in a controlled manner keeps draining out of the eye and thus keeps the pressure of the eye under control and prevents the further progression of. In certain conditions, there are some laser procedures also which can also help in treatment of glaucoma, which is not a surgical procedure, which can be done on an OPD basis. And those laser procedures also can sometimes prevent the progression of glaucoma along with the eye drops.
So, to our corporate audiences, what would your advice be with regard to, generally being alert to these kind of conditions? So, what can they do really to make sure that we are not missing anything?
So obviously, a routine eye checkup would be important. So once a year, I would say is a good starting point. And most of the corporate offices nowadays have some tie-up with for a health checkup for their employees. So most of them have a ophthalmology package also associated with it. So during that screening, one can identify whether there is a possibility of glaucoma for a person or not. Now, if there is a possibility of glaucoma, then a further investigations are advised and further tests are done. And then, depending upon whether or not the person has glaucoma or is at a higher risk of glaucoma, a frequency of follow up is determined whether they need to follow up 6 monthly or sometimes even quarterly or sometimes once a year is just enough with appropriate medication. And then that needs to be followed. The problem with glaucoma is that it is a very silent condition in most of the cases. So a person does not appreciate that there is a damage which is happening. So they do not appreciate the fact that the drops are doing something for them. Okay. And the drop has to be used for a prolonged period of time for years together. And sometimes people do get tired of using those drops and then just stop it in between. Now that becomes a detrimental effect. So it is essential that if you have been advised to use a certain drop, it has to be used. Otherwise, the constant fluctuation of stopping, starting drop is actually more problematic than having a constant.
I think we have covered these two topics adequately, but just wanted to know about some general aspects of eye health, which I think are particularly relevant for corporate workers, for people in the corporate sector. So I think one is, of course, the screen time, which we all keep talking about. So, what are the factors that impact your eye health when you're in some kind of a desk job all the time?
So the factors which affect eye health is one, obviously, is your glass power, which is technically called a refractive error. So if you have a glass power or if you know that you have been prescribed glasses, then while working on a computer, at least one has to wear the glasses. Ideally, if there are glasses, one has to wear those glasses throughout the day. But if it has been advised to be used at least during computer work, then has to be used. So that is one of the factors. The second is that while working on computers and laptops, etc., we tend to stare at it for prolonged periods of time without blinking. Okay, so what happens is if we don't blink, then the thin layer of tears which form on the surface of the eye, they get evaporated very fast, and this creates a dry surface, which is very harmful, and it also becomes very uncomfortable to constantly look at the screen with that dryness. Third thing is that if we are constantly staring at a screen which is very close to us, then the muscles which are inside our eye, they have to constantly work to keep the close thing in focus. So to avoid that, what we can do is take half a minute break from looking at the screen after every half an hour of computer work and look at something which is far off. So the rule says it's called a 20-20 rule. Okay, so like for every 20 minutes of computer work, look at something which is far off, which is for only about 20 seconds. So that will relax your muscles, and by the end of the day, it will be much more comfortable to use the computer for prolonged periods of time. Then in a corporate offices, most of the times we are working in air-conditioned environment, which is a very dry environment. It is so the humidity is sort of little bit sucked out of the air from because of the air conditioners. So that also creates a problem. So we need to supplement it by using some eye drops, especially during working hours. So if let's say the duty is for 8 hours or 9 hours, then one drop after every two hours in your eye. So that will be just four times throughout your working day. And then you keep your eyes closed for 10 seconds, 10 to 15 seconds. That should suffice to maintain the adequate hydration and adequate, health of your. Also, this 10 seconds where you keep your eye closed also is a rest period for the muscles inside your eye so that they can take up their focusing task again with equal renewed vigor later on again.
And is there something that people should look at in terms of their nutrition? Or, we keep hearing of a lot of these eye related supplements. So, are these strictly required for people, or what kind of nutrition should people follow?
See, a person who's taking a normal, healthy, balanced diet, okay, either vegetarian or non-vegetarian, do get enough nutrition and you don't have to take anything extra for your eyes as per se. Okay, unless there have been certain conditions which have been detected in your eyes already, and it has been prescribed as a as a nutritional supplement for only then do those nutrients, added nutrients in your diet in the form of capsule or tablet work. Otherwise, they are just going to be excreted out of your body with no real use. So, and then there are a lot of nutrient capsules or multivitamin capsules which are available. Some of them are produced or made by the going by the standard recommendations based on certain studies for certain conditions of the eye. Now, those are the more useful. Then there are a lot of other nutrient capsules which have like really no sense in the combination of the components that they have. So those are again of absolutely no use or even turn out to be more harmful to you. Now to differentiate between the two becomes difficult unless you consult the doctor. So it is always better to ask the medical practitioner or your ophthalmologist whether I need to take this nutritional supplements and not take something just over the counter or just because somebody else has recommended it to you.
Is there anything else that you would like to add in terms of advice to our audience?
No, so my advice to specifically because the audience, our audience is a corporate audience, is basically to have a routine eye checkup. And fortunately, all the corporate offices nowadays have a health package or for their employees. So make maximum use of that and to take appropriate step, follow the appropriate step which I just enlisted out during your routine office work as to not to focus on the screen for too long, have short breaks, like half a minute breaks, use some eye drops, again by recommendation of your doctor, which drop to use, which not to use, and wear your spectacle prescription glasses if you have been prescribed something. If you are unsure, get your eyes tested again by an ophthalmologist, get the appropriate glasses. And blink your eyes frequently because that will help in maintaining adequate hydration, and new layer of tears get formed on the eye with every blink. So that also keeps the eye moist and healthy, and it doesn't make the eye very gritty or uncomfortable by the end. So these are the certain points which I would like to.
Thank you so much, Doctor, for this wonderful session. Viewers, I do hope that you found this session useful and informative. So, as the doctor said, there's a lot that you can do to keep your eyes healthy and protect your vision. But key messages that I would like to also summarize is that getting that eye exam every year is important. It's a single best thing that you can actually do for your eye health. And so, we may think that we can see perfectly well, but then there could be a problem and we don't know it. So many eye diseases like glaucoma do not have obvious signs and symptoms initially. So the annual eye checkup is important, and of course protecting your overall health will go a long way in keeping your eyes healthy as well. So it's important to make healthy choices and take good care of yourself. Thank you. Until I see you again. Namaste.